August, President Biden signed into law the Inflation Reduction Act. This legislation says that Medicare can be involved with drug price negotiations, but it only includes 10 drugs and it doesn't start until 2023. I'd like to get a reaction to this to understand, is this really meaningful?
I'm happy to kick it off. So yeah, sure. Should the federal government be negotiating drug prices better? Absolutely. One of the things I point out is if people have free time and want to read really boring things, CBO put out a report in February of 2021, which basically compared the federal price of brand drugs net cost in the United States. And this is for government contracted things. So this is DOD, VA, Medicare, Medicaid, 340B. And what you would find net cost, which is the important number, is that even the federal government was buying drugs with 150% delta between those schedules. So what chance do we have as payers or patients when even the feds can't figure it out? Now, I think we understand it's been a long journey with a lot of different departments from HHS to the Department of Labor that kind of get their hands involved with drug pricing, even the FDA. And I think we have so many moving parts. So I applaud the administration for taking this very important first step. I just wish it was an accelerated pace. But again, let's be supportive with what we have.
Yeah, I would just add, Amanda, I think it starts somewhere, which in fact is to be lauded. So if you're a diabetic patient, you're going to feel a real impact. Your cost is going to be capped at $35 a month. So that's important for diabetics, and they're a major portion of healthcare spend. So I view it as an opportunity to keep building upon how we can do better. I think the unfortunate part is we shouldn't have gotten to this point in the first place. If we could have policed ourselves, unfortunately we haven't. So now we're going to add more bureaucracy to the process.
I'll just add two things. We heard it in the earlier session. Sometimes when government gets involved, it can be a bit of a catalyst for change, whether it is the answer or it leads to something else. We heard about the orphan drug status, kind of approval pathway, breakthrough status, and even CMS's role in getting EMRs used much more broadly all helped accelerate those things. So we'll see if this is the start of a right direction. To your point, I hope it doesn't lead to too much bureaucracy or a one-size-fits-all model. If we look inside like our commercial organization and comparing to like the $35 cap for insulin that we see in Medicare, we already have the majority of our members paying $35 or less. Through a lot of different ways, plans have decided to go about doing that inside their design. I'd hate to see that get forced into a one model in the future.
I would add very similar. I mean, these kinds of acts certainly help serve as a catalyst, and what happens in Medicare, you see it 2 or 3 years later down the line trickle down into the commercial markets, and I do believe it's going to help the commercial market significantly.